Everyone, welcome. Thank you so much for joining us today. My name is Neha Javeri. I'm a social behavior change consultant with the University of North Carolina at Chapel Hill, and together with Dr. Stephanie Martin, who is a faculty member at University of North Carolina at Chapel Hill, we co-facilitate the family inclusion in nutrition through engagement community of practice, or the FIND COP. Today, we're delighted to be co-hosting this meeting with Elevate Nutrition. Today's webinar will be focusing on engaging family members of improved nutrition in Nepal. So we'll begin with an overview of the agenda. Our speakers will start with an overview of Suohara and IMMANA interventions, and then we'll take a quick pause. We'll let questions come in, and then we'll continue with the second part of the presentation, which will focus more on the results and the analysis. And then again, this will also be followed by a question and answer for a bit longer period of time. And now I will turn it over to Dr. Stephanie Martin to give an overview of the community practice.
Hi, everyone. Thanks so much for joining us today. We wanted to let you know, for those of you who are new to the FIND community of practice, we wanted to let you know a little bit about it. It was started by USAID Advancing Nutrition and the University of North Carolina at Chapel Hill in 2022 to facilitate dialogue, learning, and resource sharing to increase family engagement in nutrition. We offer quarterly webinars, we have a listserv for questions and sharing, and we also have a YouTube channel with past session recordings. We'll share information about how you can join the FIND COP listserv. We have more than 800 members from around the world, and also how you can learn about our activities. Thank you. Now I'd like to turn it over to Sujata Bose from Elevate Nutrition, who will be facilitating our session today. Thanks, Sujata.
So thank you. So good morning, good day, good evening to everyone joining. My name is Sujata Bose, and I work for the brand new USAID Elevate Nutrition activity. I'm an employee of FHI 360. And for those of you who may not be aware of what Elevate Nutrition is, we are USAID's flagship mechanism for multisectoral nutrition. Our mandate is to support local efforts and local priorities in the planning, implementation, measurement, and learning of and from nutrition, multisectoral nutrition work. In the chat, I have plugged down a link to the Elevate Nutrition fact sheet, as well as to our listserv for those of you who would like to know more about Elevate Nutrition and keep abreast of our updates. But that's not why I'm talking right now. The main intent of my speaking right now is to introduce our trio of panelists. So I'll begin with Dr. Kenda Cunningham, who's a senior research advisor for Helen Keller International, or HKI. And before that, she used to be the senior technical advisor for the Suohara 2 project. So obviously, an expert on the topic at hand for today's webinar. She also holds an honorary assistant professorship at the London School of Hygiene and Tropical Medicine, and she's an associate editor at the Journal of Maternal and Child Nutrition. Next, we have Dr. Edward Frongillo, who is a professor in the Department of Health Promotion, Education, and Behavior at the University of South Carolina's Arnold School of Public Health. Dr. Frongillo is a globally renowned expert on household and individual food security among adults and children, and also on infant and young child feeding, growth, and nutrition. He has extensive experience conducting mixed method, both quantitative and qualitative evaluations and research in Sub-Saharan Africa, Latin America, and South Asia. And he also has extensive experience providing training and technical assistance to researchers in developing countries. And then rounding us out, we have Evaniya Shakya, who's on her way to becoming Dr. Evaniya Shakya. She's pursuing her PhD in nutritional sciences at Penn State and also works as a consultant on the IMMANA project. She has a bachelor's degree in biological sciences from Cornell University. And as an international student from Nepal, she's passionate about maternal and child health and about complementary feeding practices in low and middle income countries. So with that said, I'd like to hand over to our panelists to begin the presentation. And just as a reminder, that we'll have 10 minutes of presentation followed by 5 minutes of questions, and then again 10 minutes of presentation followed by 15 minutes of questions. So we'd ask you to hold your questions till those Q&A pauses, but feel free to populate the chat with your questions. And during those breaks, we'll try to triage as many of those questions as we can. So I will hand over to, I believe, Dr. Cunningham to begin.
Thanks, Sujata, for the kind introduction, and thanks to the FINE team for organizing this, and thanks to all of you for expressing your interest and attending the webinar. Today, the presentation is about innovative methods and metrics for agriculture nutrition actions, project that Helen Keller has been working on. And next slide. As was just said, we will start with an overview of Suharto and IMMANA, then we will have a Q&A, and then we will go with the findings and key takeaways, followed by another Q&A. Next. So I wanted to give a bit of background before jumping into the IMMANA project, because the IMMANA project is funded to be a secondary analysis of the Suharto evaluation data. Suharto, as many of you might know, was a USAID project in Nepal in 2 phases, beginning in 2011 and completing in 2023. It's a multisectoral intervention which aimed to address maternal and child undernutrition via interventions in health and family planning, nutrition, agriculture, WASH, governance, and gender equality and social inclusion. You can see in the map that Suharto covers approximately 60% of the communities of Nepal, spanning east to west, and spanning from the top mountains of Nepal, which border China, all the way down to the flatland plains bordering India in the southern part of Nepal. There should be other bullet. So this project, as I mentioned, was 2 phases. You can click on all of them, Neha. Was in 2 phases, with the second phase of Suharto ending recently, and we covered approximately 3,353 wards in the new post-federalist system, which I'll mention again later, approximately 20,000 communities when Suharto was designed. The aim was to reach more than 1 million households, including 2 million pregnant and lactating women and children under the age of 2, known as the 1,000-day period. Next. Suharto was an intervention, as I mentioned, spanning different sectors. It focused on disadvantaged groups, which means that although all households in the 1,000-day period in the red areas did receive core interventions, there were intensified interventions, for example, in food insecure or remote communities. The Suharto program was aligned with the government of Nepal's multisectoral nutrition plan, which has also recently completed its second phase. Therefore, the interventions were designed to build on government structures and government community platforms so that sustainability would be embedded from the get-go. The life cycle approach was used, and Suharto in its design, even in the USAID request for proposals, already included the request for family approaches to address malnutrition. And of course, with all of this, a well-designed monitoring and evaluation and research system was needed so that learning and data could drive program adaptation throughout the life of the project. And some of that data is why we were able to do the IMMANA project as a follow-on research project. Continue. No one, I hope, can read and interpret what this slide says. This is only meant to highlight that there was a theory of change designed at the very beginning of Suharto, and it was an iterative process. The one you're seeing on this screen was the adaptation made at the beginning of Suharto 2. It was color-coded to represent the fact that Suharto worked in different sectors. So, for example, blue were the water sanitation and hygiene, red, the health services, yellow, the social and behavior change approaches, purple, the nutrition governance. And you can see arrows in all different directions as the convergence of these activities to reach different outcomes, and ultimately the impact level of improving nutritional status for women and children. So if you want to actually look at this SBCC pathway, the first step is to look at the the first step would be to look at program exposure. But what do we mean by program exposure? There the SBCC pathway had 4 key categories of interventions. I say categories because these were adapted to each specific location, each specific subpopulation. You can continue, Neha. The first is what is known as interpersonal communication, frontline workers engaging in a door-to-door approach to reach families to discuss things like infant and young child feeding, drinking water treatment, antenatal care, postnatal care, and so on. There were also community events that were mobilized that included Health Mothers group meeting and other group meeting. You can continue to click as I speak, Neha. These are the community group meetings you can see there, where women are gathered to discuss these similar important topics. These mostly happen through the government platforms of Health Mothers groups and other female community health volunteer-led activities. Continue. This is the Banchan Amma radio program, which means, as Mother says, this radio program was adapted over time, in part due to reaching community members, because Nepal has the highest rates of male exit migration in the world, meaning that a lot of men are not in Nepal and are able to hear through the radio. Therefore, Facebook and YouTube were added as mechanisms of reaching the whole family. And finally, there's an SMS component to the program, interactive voice response, and other mobile-based interventions. As you can imagine, a multisectoral nutrition program, there are a lot of different topics that are important to discuss in your social behavior change activities. I have listed here some very common ones that were used and that span these platforms. And these are actually the 12 behaviors that we ended up including in our models that you'll hear the results of today. Of course, there are definitely other topics that were also covered in these platforms that are relevant to the thematic areas Suharto was working on. Continue. So the evaluation has already been conducted, and we have had different evaluations of Suharto to match the different program components. A household level evaluation, primarily assessing the SBCC component, which was a quantitative study, but there was also a health systems evaluation and a nutrition governance evaluation. The household level evaluation results focused on improvements in maternal and child nutritional status and practices. I believe a link is being posted in the box for anyone who hasn't seen this recent publication with the lead author, Dr. Ed Frongillo, who you'll hear from in a moment. But as you can see, we have seen over time, in comparison to the comparison areas, that Suharto was able to reduce maternal underweight and improve length of infants. And at the same time, a host of complementary feeding behaviors were all improved quite substantially, including very challenging to move indicators, such as feeding a sick child more and administering ORS and zinc for diarrhea. Continue. Continue. I wanted to call us back to the theory of change in light of the evaluation. As many of you are familiar with what evaluations can tell us, whether they use a randomized controlled method or other quasi-experimental methods, they often look to see whether the program achieved its ultimate aim of moving an impact and/or some key outcomes. Despite that, they do not tell us what happened across all the boxes and why you did or did not achieve impacts that were expected. For that, mediation analyses or some sort of path modeling is needed. Ultimately, mediation analysis will tell us all the pieces of the puzzle and be able to link all the boxes together. But that still would give you a picture of what happened through your pathway overall. And a lot of us on this call are quite interested as well in concepts of equity and how programs play out for different subpopulations. For that type of an analysis, you need to use something called moderated mediation, of which we will share an example today. Continue. So that's the Suharto background, a very rapid overview of a 12-year project that led us to the proposal for an IMMANA grant. This IMMANA grant is using causal mediation models to be able to examine the multisectoral program impact pathways and to see whether agricultural interventions layered onto those SBCC pathways, for example, or dimensions of equity, such as wealth, for example, modify or moderate the way that those program impact pathways operationalize themselves. It's a 2-year secondary analysis project with several objectives you can see identified there. But primarily the idea is to apply methods that are being used in other fields to the space of theories of change, and to say when a development program has a well-articulated theory of change, can we use quantitative methods to test out those different pathways that have multiple steps or mediators along their paths? And can we see if there's variation in how those pathways manifest themselves under different contexts? And of course, the program also has the objectives of raising awareness about these methods and their importance, as well as ultimately developing a toolkit to facilitate further uptake of these types of methods among those involved in monitoring, evaluation, and research. Next. So you might notice these yellow boxes, which came from the original theory of change. So rather than testing the full theory of change, we first started with the yellow boxes, which was one specific aspect of the SWOTR program, the social behavior change aspect, which I explained earlier about the 4 categories of interventions. Next. And next. We'll start with the first box of the first pathway, which is simply looking at whether the program, what program exposure looked like among 1,000-day mothers. You can see here that at inline, about 50% of households, which makes sense because this includes intervention and comparison data, on average, 50% of households had exposure to at least one of the platforms. If you look at the bottom 5 rows of this slide, you can see that about 50% had 0 exposure, and then about 21% were exposed to at least one of these 4 types of interventions, and so on. The data is included. You can also see that you are able to disaggregate this data by poorer households and wealthier households. So we've taken the bottom 2 wealth quintiles and the top 3 wealth quintiles. And you can see that exposure is slightly higher among the wealthier populations. There's a gap of about 10 percentage points. Next. Moving beyond the first box, we can go from exposure to the program and look at whether there is what the levels of awareness to certain health, family planning, nutrition, and WASH services, platforms, and ideal behaviors are. These are the questions you usually see in a survey, like, have you ever heard of X, Y, and Z? And then knowledge, which we tested with open-ended questions, where we would ask, for example, how many antenatal care visits should a mother receive? Or perhaps we collected dietary recall data to understand the knowledge on diets or infant and young child feeding, and ultimately the practices related to all of those thematic areas. What you can see here is similar to the slide before, where we've created a scale. I mentioned the 12 specific behaviors that we looked at when I described the SWOTR intervention. Using those same 12 indicators, we looked at the awareness of those particular behaviors, open-ended knowledge on those 12 behaviors, and then ultimately the behavioral practice. And as you can see, although there is awareness of about 10 of those 12 topics, when we get down to the behavior level, they're practicing almost half of the recommended behaviors. And so there is a drop between awareness, knowledge, and behavior consistent with what we see in the literature. Interestingly as well, there is not a huge gap between the poor and the wealthier at any of the 3 levels. Moving on. So the question is, when you flip the yellow box on the side and you want to trace out the entire pathway from exposure to awareness to knowledge to practices, this is what the mediation analysis allows you to do. So far, you've seen the descriptive results, but when you put it all together, is there actually a linkage? Meaning those who are exposed versus those who aren't exposed, are they more aware? And are those who are more aware more knowledgeable? And in turn, are those who are more knowledgeable practicing more of the ideal behaviors? This is, of course, the theory of change that the IMMANA analysis seeks to now untangle. And then, as you can see in the blue box, we have questions about, are there any differences by wealth? And today we'll show you equity as one example. But of course, we are also looking at caste, maternal age, maternal self-efficacy, remoteness, and other indicators of equity as we go along. I'll now turn it over to my colleague Evaniya to share some of the results of the modeling done today. Actually, I think before Evaniya, we're going to pause to answer a few questions. So Sujata, I believe it's back over to you, actually.
Sure, thank you. Thank you, Kenda. So are there any questions from our audience? You can speak out loud or you can populate them in the chat, whichever is easier. And so I think we have a comment from Andrew Taylor, which says that work from basics in the 1990s showed a relatively weak link between knowledge and practice. So I don't know if you'll be covering that in the second part of the presentation, or if you wanted to speak to that now.
Yeah, thank you for that. I mean, I think the general knowledge is that knowledge is maybe important for practices, but insufficient. There are other things that are important for households to be able to adopt promoted practices. And yes, we will be covering that. We'll be seeing some models, both for the mothers as well as the grandmothers and male household heads, that show what that link is that we did find.
Great, thank you. Any other questions, comments? And if not, I will go ahead and I will ask a question, which is, I'm curious to know how you planned for sustainability.
Yeah, so that's a very big question because of the scale of the project, both covering about 6 sectors, and as I mentioned, more than 20,000 communities. So we often think of sustainability at different levels. So sustainability of the practices that you're promoting, like how long do we need to have an intervention for those practices to be sustainable? Or we can think of sustainability of the actual interventions themselves as 2 examples, but there are many ways I think of defining this: financial sustainability, et cetera. We actually, from the beginning, had twice had handover design, actually, with the idea of kind of working with governments to be able to gradually take over some of the intervention components. Of course, the reality is that in 2015, there were massive earthquakes in Nepal, and in 2018, 2019, there were an entirely restructuring of the country to have decentralized power, which meant that we saw lots and lots of people in leadership roles who didn't have training, and therefore the concept of handing something over to an entirely new leadership became a bit more complicated. But I can give 2 examples of types of things we did. One is that in every municipality in which we worked, we held sustainability workshops with local leaders and followed them up the following year in every 6-month increments. The idea being that governments, awareness was raised, training was done, but more importantly, that governments were choosing for themselves among a menu of interventions that we were doing, which ones they would like to continue and put into their red books. And from a data perspective, we followed this by checking annual work plans, semi-annual work plans, as well as budget allocation and utilization in the thematic areas that we work on. So yeah, this is a whole nother topic. I mean, perhaps beyond the community engagement or the grandmother and approach, but sustainability was a major component of Swahara and came from different angles, like I said, about the behavior or the interventions themselves.
Yes, a very complex topic, but thank you for that. That provides some insight. And then we have one question on whether you disaggregated by family members in terms of exposure, as that seems to be sort of the focus of this particular group.
Yes, definitely. I was highlighting some of the descriptive results for the mothers, but Evaniya will be showing the results, both descriptive and modeling results for the male household heads, as well as the grandmothers for these same households.
Okay. And are there any other questions from our audience before we move on?
There was one question we received beforehand about some of the formative research that you did to examine the roles and influence of family members. I wonder, Kenda, if you could speak to that briefly.
Yeah, so again, a big topic if you think about 12 years. My understanding is that there was a GESI analysis done even by USAID before the request for proposal was issued to try to understand gaps based on gender, but also based on different generations and things like that. And in year 1 of both SWAHARA 1 and SWAHARA 2, there was a round of formative research done, which involved different types of household members, whether it be the mothers or the grandmothers or fathers and so on, to try to understand different generations and how they would uptake certain SBCC components. We also use the year 1 annual survey data to try to understand and to try to tweak our approaches for the grandmothers and the male household heads. So as an example, we had some interventions we were planning for the grandmothers, and then we realized that over 80% of the grandmothers in our population area, if the mother was being reached by a certain platform, so was the grandmother. And so we were able to kind of reallocate resources that had been planned to have a nuanced approach for grandmothers and use those, as I was mentioning the example of Banchanama, use those to maybe reach men and fathers who weren't in the households and were not being reached by the program. So I would say that there was initial formative research, but for SWAHARA, it was an ongoing process where we kept checking the data to see who was being reached and also which populations had which knowledge gaps to be able to tweak our interventions as per them. Hope that makes sense.
Yes, and sort of related to what you just touched upon, there's a question from Judy Obel on the extent to which grandmothers, but also mothers-in-law, were explicitly involved, given that we know from other research in Nepal that they often have a strong influence on younger women's practices.
Hi, Judy. Thanks. Yeah, I think it's an interesting situation in Nepal right now, because in the last 8 years or so, every time we've collected a survey, the maximum we have living with grandmothers now is about 45% of our families. As I mentioned earlier, Nepal has extremely high rates of exit migration, and the dynamics in the household are really changing. We have a lot of mothers living either with their husband in a more urban setting, or when the husband migrates abroad, even the mother living alone with the baby. So we kind of think about two different household types when we do our interventions: the joint households and the nuclear households. And for the joint households, which are the ones you're talking about, Judy, definitely there's engagement of the grandmothers. But we also have a whole 50% at least of our households where the grandmothers aren't really residing in or having as large of a role as they used to have. The other part that's happening is Nepal has education for all now. And oftentimes the grandmothers are now, and even the grandfathers are kind of transferring responsibility for decision making to younger generation, which is a new phenomena happening because of the recognition of the value of education.
Yes, and there's just a comment that grandmothers can be influential even when they don't reside with the family. So just to keep that in mind. I don't see any other questions from the group, and I think we are probably at time for this question break, but there will be a chance to ask questions again in another 10 minutes or so. So yeah, turn it back to our panelists.
Thank you. So I'll be going over the results from the structural equation modeling for the mothers, and then going into some of the summarized results for the male household heads and grandmothers. Next slide, please. So first, we analyzed data from around 2,040 thousand-day mothers to understand how exposures to interventions affects nutrition practices through the SBCC pathway. We use the structural equation modeling to assess these relationships. Next, please. And so the coefficients that are displayed here are standardized coefficients, and so they are not meant to be interpreted as a direct measure of effect size, but rather to compare the magnitude of these effects across different predictors. So if we trace the theory of change pathway, looking at exposure to interventions, to multisectoral nutrition awareness, knowledge, and nutrition practices, what we see is that along this path, we see positive and significant associations, and the other direct pathway from exposure to interventions leading to multisectoral nutrition practices is also positive and significant. What we found that is the cumulative impact of the theory of change pathway from exposure to awareness, knowledge, and practices is around 0.04, which is almost 4 times, and next slide, please. So if we looked at the direct pathway, which went from exposure to interventions to practices, it was 0.15, which is almost 4 times the indirect pathway. So other conditions may have been affecting the exposure to interventions to the relationship to nutrition practices. Outside of the theory of change, maybe social norms or women's empowerment. Next slide, please. And we also looked at, we examined the SBCC pathway moderated by wealth, looking at the poorer 40% of households and the wealthier 60%. Next slide, please. And then looking at the theory of change pathway from exposure, awareness, knowledge, and practices, for both the poorer 40% and the wealthier 60%, we see positive and significant associations along this pathway. And looking at them directly from exposure to interventions to multisectoral nutrition practices, we see a positive and significant interaction. But what is different is that if we looked at the direct path from exposure to practices, for the poorer 40% of households, this path is larger among the poorer households compared to the wealthier households. And so when we calculated it, we see that around 40% of the relationship of the poor households is explained by the theory of change pathway, but 54% for the wealthier households. So although looking at this diagram, we see that interventions worked similarly for both wealth strata, but for the poorer 40%, their practices may have been influenced by other conditions. Next slide, please. So we also looked at the SBCC pathway for male household heads. If you look at the descriptive results, we had a smaller sample size of male household heads, and this again, as Kenda mentioned, may have been due to migration at the time of the survey. We see that male household heads were less exposed to the interventions. About 25% were exposed to any of the platforms, compared to the mothers, where around 50% were exposed. Awareness was also considerably lower among men compared to mothers. Knowledge among men was also lower, but the gap between awareness and knowledge was much smaller among male household heads. And we also saw that the gap between ideal practices and knowledge was much smaller for men compared to the mothers. We also did a similar structural equation modeling pathway for male household heads, and the theory of change pathway and the direct pathway was almost identical to that of the mothers that we showed earlier. Then we looked at the pathway moderated by wealth. We find that the theory of change pathway was almost similar to that of mothers, but when we looked at the direct pathway, for poorer men, it was very identical to that of mothers, but it was not significantly associated among wealthier men. Then next slide. We then looked at the SBCC pathway for grandmothers. There were around 817 grandmothers that we looked at. Fewer grandmothers were available for interview. Similar to men, around 25% of grandmothers were exposed to any of the platforms, and awareness was considerably lower among grandmothers. It was similar to men, and knowledge was also lower among grandmothers. But the gap between practice and knowledge among grandmothers, there was no gap between that. And then when we looked at the theory of change pathway, they were very identical to that of mothers and male household heads. And the direct pathway showed a much weaker association for grandmothers leading from exposure to practices compared to the mothers. Then we also looked at the SBCC pathway moderated by wealth for grandmothers. And we saw that the theory of change path was almost identical to that for mothers, for both poorer and wealthier grandmothers. But when we looked at the direct pathway, they were almost identical to that of mothers for poor grandmothers, but not significant for wealthier grandmothers. Next slide, please. Next, I'd like to hand it over to Dr. Frongillo.
Okay, thank you. I'm pleased to be with you. So we have wanted to call attention to five points here. So first of all, that in Suhara from the beginning, there was an idea that we should really be paying very close attention to the theory of change, and that has allowed the analyses that we've shown to quantitatively measure these program impact pathways, because the program and data teams had designed a well thought out program impact pathway, and then the steps along those paths were measured. So in order to be able to really do this, it requires that be done right from the beginning. The second point is about measurement. So decisions were made along the way to simplify each step of the program to represent that in a way that's measurable, while remaining in line with the programming and the theory of change. So effort needed to be made to think through how to measure each of those paths. And the third point is that, as Evaniya has just presented, that multiple household members were assessed. And so thinking about it from the perspective of multiple household measures influences then what gets measured, who gets measured, and then how the monitoring and evaluation systems are set up to be able to collect data, not just for mothers and child dyads, but also to get a broader picture of the others who are likely to be influential. The fourth point is about equity, that the idea of in a program like Suahara, which is intended to be context specific and multi-sectoral and multi-dimensional, is that then the M&E system has to be able to collect information to understand how the program effects might differ across subpopulations. And what we've seen here in the data that were just highlighted is, for example, among the poorer households, the poorer and the wealthier households, the theory of change worked about equally well. What was different is that in the poorer households, other influences were also much more important than they were in the wealthier households. And so those kinds of insights come from thinking about it through an equity lens and thinking about what are the modifiers or moderators of how the program of theory works. And then finally, what we've shown is focused on the behavioral change component of Suahara, and there's more work to be done now to unpack the agricultural and other parts of Suahara and their pathways, and then to be able to try to fit this together from a sort of total systems perspective for Suahara, which was, you know, an example of a large scale and complex multisectoral program. So we'll stop there and then take further questions about what we've discussed and shared with you.
Yes, so I see in the chat there's a little bit of back and forth on what the concept of family is. Does it extend beyond the household? And Judy, I don't know if you wanted Kenda or other members of the panel to further elaborate on that, or whether you're okay with the explanation that Kenda has already provided in the chat. And feel free to come off mute to respond.
Hello. Yeah, Kenda, nice to see you and all of you. Can you hear me? Yeah?
Yes.
Okay. Oh, my screen just went off. No, I was just, asking the question about, the household versus the family. I think, conventionally, from our demographer friends, etc., we focused on the household, but I think in non-Western contexts, including Nepal, and especially, well, I've followed a lot the work of Joanne Morrison, who's been in Nepal for many, many years, looking at intra-household dynamics, roles, and influence. And she talks about the hierarchies based on age and gender. And so I think the household, just the fact that the residential residence I don't think is not sufficient for understanding the influence of other significant and powerful household family members, which definitely pointing to the older women, which is not only the paternal and maternal grandmothers, but also the social network of grandmothers that are family and extra-familial members. Yeah. Mm-hmm.
So, Kenda, I'm not sure if you wanted to respond or elaborate on anything that Judy mentioned, or
Yeah, I can say a few things, and I just realized that there are a few participants who are actually from the intervention team, including one of the SBCC designers. So if Indra, if you or others want to comment, feel free. I mean, yeah, I think Judy, no one would disagree with that. We all know that we have influential family members, even in the Western world, who don't live in our household. There's no doubt. Conceptually, that is the truth. I think I would say two things. One, I'm quite cautious when I talk about culture or how social dynamics works to, especially in a place like Nepal, where they've just become a lower middle income rather than a low income country. Suddenly you've got a generation educated for the first time. You've got decentralized power. I mean, the context is changing so fast of how these families work. And we do have some data showing that no, grandmothers are not primary decision makers in a lot of the households anymore. Joe's work is in the Terai, which borders in northern India, where there are certain types of ethnic groups where the context is maybe a little bit different than in the hill communities and the mountain communities. So I think just to reiterate something I said earlier in the call is that there's a lot of heterogeneity to how these households are structured and who influences what. And I think it's important that none of us take a one size fits all approach on either side of that question. The second is the frank reality of this is a donor-funded project, and there's a limited resource base, whether you're talking about how many people you can target in an intervention or collecting data. I mean, I think already collecting 3 household members every time you go and collect an at-scale survey is huge. So it is a challenge when you know that you need to target a whole community. And, there are things like our radio program, which obviously target beyond a household. But when you're talking about interpersonal communication with 1,000 frontline workers to reach 2 million households, I mean, there are bandwidth issues, I think, for program and for data that we should also keep in mind that sometimes might limit what we can do beyond, reaching every single person in Nepal.
That's great. So I don't know if Judy has any follow-up. Otherwise, we have a question which Kenda's already. Oh, go ahead, Judy. Sorry, go ahead.
No, I think the key point for me is that at the outset, it's important to determine the respective roles and influence based both on gender and on based on gender and on generations. That's, and of course situations are changing, but I think that's the main point, not to assume, but rather that formative research should show that. And then the utilization of resources should, seems to me, follow who are those who are identified as being more involved and having more influence. Mm-hmm.
Now I see that Indra has raised her hand. I don't know if that's in response to this particular point or if it's a separate question.
No, this is as Kenda mentioned. I'm one
of the
team members that we work on the SBCC for Suahara. Judy's question, I think that raises some important thing for us as well, something to reflect on. When we collected the data, actually, so what happens in Nepal is almost all of the households after marriage, the woman goes to the husband's home, and she lives with her in-laws. So here, when we are talking about grandmothers, these are the mother-in-laws of the woman. But one important thing that she might be taking cues from her own mother, that relation and that the role of the woman's mother in making decision. For example, some activities like childcare, after a child is born, they go to their mother's home for a particular time, like 6 weeks or something. So that has that results in many other aspects that impacts many other outcomes like exclusive breastfeeding or complementary feeding, this type of things. That's a important question, and maybe do some maybe qualitative research and explore further on how actually these two grandmothers are impacting the child care and these nutritional practices. Thank you.
Okay, so if I may, I'd like to go to a question from Andrew about whether this research confirms that knowledge is relatively unimportant compared to exposure. And I know that Kenda has answered that in the chat, but that's a very important question. So it might be good if you could just reiterate and expand upon the answer you've provided.
Yes, I don't know if it's possible to put one of the model slides that Evaniya was sharing, just to be really clear. So what I was saying is that in our analyses, we did not compare the relative weight of knowledge to practice versus exposure to practice, which seems to be the way this question is posed. But rather, we're testing the translation of exposure into raised awareness, in turn into knowledge, in turn into practice. Because again, as Ed was highlighting, this was a program developed theory of change, and we are trying to quantitatively test that theory of change. Maybe one or two slides before that. Back, yeah, one more. And yeah, so as you can see here, if you remove the animation, we do find that there is an association. We do find a positive effect between knowledge to practices. And we don't have a test in this model of pure exposure to practices. What you can see on the bottom is basically that we're saying, other than the theory of change, what are the other ways in which program exposure might have influenced practices? So that's why you get a beta coefficient as well for the bottom line. But we did find a positive significant effect linking knowledge to practices for all three household members tested. Evaniya or Ed, would you like to say anything else about the model and the results on this point?
Okay, so I think it would be great to have some back and forth on each question, but in the interest of getting through the questions we have from the audience, I'm just going to jump ahead. We have a question on collecting data from household members beyond mothers and children, and the fact that this requires additional resources to be allocated. Can you share Suhara's experience on how you address challenges related to getting and allocating additional resources? And then the sentence cuts off, but I assume it has to do with, gathering data for those additional family members. If not, if Gargi could just correct me.
Thank you so much. And thanks, Kenda. It's really nice to see you and great work on Suhara, especially the equity analysis. My question is definitely cut off, but it will be helpful to know for other programs how you managed additional resources in both getting and allocating them for data collection, different household members. Thank you.
Yeah, thanks, Gargi. Nice to see you after quite a few years. I mean, I think in our case, it was quite simple. As you know, we were talking earlier with Judy, the formative research really highlighted that there were other people that were important. There was a lot of global evidence also emerging on the importance of, other household members, family members beyond the mother. And so we decided within our IMMANA system internally that we would collect data on more than the mother. Now, there were really tough decisions, as Indra was saying, there are two grandmothers, even if we don't go beyond grandmothers, as Judy was recommending, even grandmothers, there are two. And some mothers are living with the husband's mother, and some are living with their own mother, depending on the stage of the life stage, let's call it, of the baby especially. And so there was a discussion about, should we go and interview the other grandmother? And that would have required a lot more resources, additional survey teams to go to different locations and so on. And so that level of resource was decided, not to be allocated, but there was a decision to limit it and at least collect data on those who we could find within the household, and to administer very similar questionnaires, because programmatically, we were aiming that to improve the knowledge and the understanding around nutrition and nutrition-related topics for all these different family members. So for example, frontline workers were encouraged that when they approach the family, that they talk with all different family members. We learned very early on in Suhara that one of the reasons, men were not as involved in ANC, PNC, and even young child feeding was lack of clarity on their role. So Indra and another colleague, Deepak, and others developed a really cool intervention called Letter to the Father. And it was not coming from a technical perspective. It was coming from an emotional appeal in which at the first ANC, there was a letter sent home from the baby, with a picture of a baby, and it was from the baby's perspective, asking the dad to do certain things for the mom and asking the dad to do certain things for the baby. And so there were different intervention approaches like this that were happening, and we knew it would be kind of important over time to kind of see what was happening with knowledge levels among populations other than the mother, and therefore internally we allocated those M&E resources. I'm not sure if that really answered your question, but hopefully it did to some degree.
And if I could just build on what Kenda just said and try to tie together a couple of things that have been asked. There's an emerging understanding, some of it influenced by health communications experts, that what really matters in the end is in terms of whether knowledge, awareness and knowledge gets translated into actual changes in behavior, really rests on how that information gets processed in people's immediate social networks, their personal network. And so one interpretation of what Kenda just described is that inviting fathers to have a role means inviting them into the network in which those decisions get made and then get translated into practice. And so when we ask the question, does knowledge matter? Yes, knowledge matters, but it matters if there aren't such strong resource constraints that you can't do what you're supposed to be doing, even though you know it. And knowledge matters in terms of how it then influences how people think in this social network, because people in the kinds of networks that we see in Nepal and in many other countries, those immediate networks, if there isn't support from other network members, if you like, then it's really difficult to translate things into practice.
Yeah, that reminds me of what's been going on with FGM in the Horn of Africa, that where there's education only, it's very hard to get a shift. Whereas if there's a woman-led whole village initiative to simply stop the practice, then it does translate into action. So, yeah, within the basics programs in West Africa and Madagascar, there was a lot of work on women's groups and positive deviance and leadership within the communities and that they sort of stopped trying to work on knowledge and education and much more behavior and exposure and group action, flags on health centers and so on.
Great. And we have another question from Andrew about, with the looming expectation of food shortages and food price inflation globally for a number of reasons, are there any thoughts or lessons from Suhara for preparing for those sorts of crises?
I'm going to suggest that we offline on that with the agriculture team and other teams. I mean, inflation right now in Nepal, I just came back last week. It's crazy high, and it's definitely going to magnify some of the challenges we saw in SWATA 1 and SWATA 2. But I think that topic is on food shortages and is a bit beyond what we're presenting on today.
Okay, so then we have another question on, can you help us understand the differences that you may have found between poorer and wealthier households in uptake of the key behaviors? And I know that you touched upon that in the slides to some extent, but there was a lot of information. So just maybe sort of the key takeaways on that point.
Yeah, I mean, if you want to go back to Evaniya's slide that shows wealthier and poorer households, I think what we were trying to do with this analysis is say, not only did this hypothesize, we were trying to quantify whether the hypothesized theory of change actually materialized. And then we said, okay, it might materialize different for poorer households than wealthier households. And what we found was that the theory of change, excitingly, did materialize. There's strong evidence that the program achieved its intended theory of change, both for poorer and wealthier households. You can see it there by the positive coefficients and the p-values. But what Evaniya was pointing out, you can see on the bottom line, which once again is trying to say, how did exposure relate to practices beyond this hypothesized pathway. So the exposure might have changed social norms, as Ed was talking about. Maybe it changed women's empowerment. I can give an example. We know that our interventions encourage poorer households to link up to cash grants and other government programs. So there are other things than knowledge pathway. We all know that in every intervention, this one was articulated, so this is what we measured. But beyond that one articulated, did something else happen? And what you can see there is for the poorer households, the program translated into improved practices by another method other than knowledge, more so than it did for wealthier households. In other words, the theory of change explains more for the wealthier households than for the poorer households. For the poorer households, something more was happening. And we're not surprised by that because we targeted the poorer households, encouraged them to go get cash grants. We targeted the poor households, trying to shift social norms by working at a community level, not just with the household, and so on. So I hope that helps to explain a little bit more this variation in translation to practices.
So
Just to add to that, Kenda showed at the beginning, though, that the wealthier households had a little bit more exposure. But what she's saying here is that once people were exposed, then the translation through the theory of change from that exposure to practices was about the same. What was really different is that for poorer households, there are other influences that matter in terms of whether or not they practice.
So Lisa, I don't know if that answers your question or if you had something more specific in mind.
Oh no, please go ahead to the next question. Thanks.
Okay.
That's great.
So I think we'll have time for at least one more, and I'm going to try to paraphrase here a question from Gudrun, basically asking whether you interpreted the lower awareness among men, but almost equal in terms of knowledge and smaller knowledge practice gap as somehow being interpreted as once men do know or become aware, they somehow immediately know and they're more able to translate knowledge into practice, perhaps because of higher decision-making authority or control over assets. So I'm sorry if that's not very articulate, but if you could sort of speak to how you interpret the findings around men being able to translate more quickly into action.
So actually the coefficients, if I look at them really quickly, I had written them all down on a piece of paper, are very similar for men and women. So I wouldn't necessarily interpret that, men were able to translate things into better knowledge or practices more so than the mothers. Rather, that if you just do descriptive analysis, we see that fewer men were reached. That's definitionally true. This, as we mentioned, could be due to the seasonal migration pattern, and those who are there for the interview weren't there during the intervention. There are many factors. But we see that regardless of household member, once their exposure happens, the theory of change pathway happens at a very similar magnitude for all three household members.
Okay, and then very last quick question from Andrew. Does this give you a whole new or bigger theory of change?
I'm not sure what that means, but I'll end by saying that if you recall the original theory of change, it was multicolored with different boxes. We had purple for governance, blue for WASH, red for health systems, and yellow for SBCC. And what I can tell you is we've just now finished SBCC pathways modeling, and we are now, as Ed said, planning to look at the other pathways and then to pull it all together in one big pathway as it was originally designed. So yes, there's a much bigger pathway to be modeled because Suharto was not only an SBCC intervention.
Okay, so I think we're at time. So I will hand it back to, I believe, Neha for the closing.
Yeah, thank you so much. And thanks to everyone for joining. Thank you, Sujata, for doing a wonderful job in facilitating the Q&A and the whole webinar. And thank you to all of our presenters, Dr. Cunningham, Dr. Frongillo, and Evaniya. This has been wonderful. I'm going to send a link once more in the chat if anyone would like to join the Find COP listserv. We will announce upcoming meetings. We will be sharing the slides from this meeting as well, and we will be also, it's a place for sharing relevant resources. So the link at the beginning is there in the chat now. And thank you again for joining us today. I hope you all have a lovely rest of the day, and we hope to see you at the next meeting. Thank you.
Thanks very much.
Thank you.
Thank you, everyone.
Thank you.
Thanks.